It's 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the nation. In just a few moments, we're going to cut into the briefing at the Sejong Government Complex with simultaneous interpretation available for you in English. We're going to go into the briefing room where Kim Gang-nip, Vice Health Minister and overall coordinator of the Central Disaster and Safety Countermeasure Headquarters, will be sharing the latest figures and updates with us on the COVID-19 situation in the country, and he's just taken to the podium, so let's take a listen.
We are also joined by Mr. Yoo Im-chul, Lee Sung-hee from the Education Ministry, Chung Hyang-mi from the Culture Ministry, and Mr. Park Jong-hyun from the KCDC. We also have sign language translation available. First of all, here is Mr. Kim Gang-nip with the briefing on the COVID-19 response. Let us begin our regular briefing for June 10th, Wednesday. As of today, midnight, we have 50 new cases. And of them, 43 are local transmissions, while 7 were imported cases from overseas. As of midnight, a total of 11,902 have been confirmed as the confirmed patients, and a total of 1,015 are in quarantine undergoing treatment. We had 2 more fatalities as of yesterday, and the death toll now stands at 276. I extend my deepest condolences to the deceased and the members of the bereaved family. This morning, the KCC held a meeting presided over by Prime Minister Chung Se-kyun, and we discussed many issues, including the QR code entry log and the quarantine measures for the districts, and also adjusting the week of a special holiday week here in Korea, and the exposure of and the deletion of the information of one's movements. And Prime Minister Chung Se-kyun has also said and expressed deep concerns over the increase of cluster infections in the metropolitan area, and he stressed that for the false testimony in the epidemiological investigations, these people will be subject to stern legal actions. Moreover, he also touched upon the issue of the Daegu city's illegal emergency allowance for the public officers, and he said that these allowances need to be paid back as soon as possible. Here are the updates on the domestic infections as of today midnight. As said before, we have 50 new patients. Out of them, 43 are local transmissions. In the metropolitan area, we have 40 cases that have happened, and also we have 1 in Gangwon-do province, 2 in Gyeongnam also. And they are also in relation to the metropolitan outbreak. And the number of the metropolitan outbreak is increasing, and on average they increase at an average of 30 to 50. In particular, we are seeing continued outbreak in the small groups and gatherings, as well as at facilities that have been under the blind spots of the government quarantine control. Therefore, the government is exerting our full efforts to inspect and look into these cases. However, realistically, it is very difficult for us to look into every single of the business establishments and all of the blind spots facilities. So we ask for your continued participation going forward, and at all of the public multi-use facilities and small gatherings, we ask all members to wear your face masks, and please please have a distance, and please refrain from going to essential gatherings or social meetings, and we ask you to refrain from going to confined and poorly ventilated area with high population density. The government is putting forth all of our preemptive efforts to take out quarantine measures going forward, and if we find those people who have been giving false testimonies, we will be asking and having them to be subject under stern legal actions and consequences. Starting from today, high-risk facilities, including 8 of the nightlife entertainment venues, including bars, clubs, and singing rooms, will be mandating to have a QR code-based entry lock system for all of the visitors. And some of the multi-use facilities are also subject to the mandatory use of such QR code entry lock. And even though the multi-use facilities are not under the mandatory use, we also advise the wide implementation of such system, and including the private academies, they will also have an incentive-based system. And during the few weeks, we had a pilot program for the QR codes, and we also found some of the difficulties among the senior citizens. So we are going to expand the companies that issue the pass codes, PASS, and we will also promote these guidelines, including a video that we will watch just in a bit. And we also have a grace period for the following week or so, and we will mandate all of the facilities, high-risk facilities that is, to implement the QR code-based entry lock. And we will also continue to revamp our the applications to enable the public's convenience. And we also ask for the members of the public to actively participate in our measures. Next, we have the quarantine for the testings for the public officials in the district governments. And this weekend, on the 13th of June, we have the entrance exam and selection exam for the public officials in the district offices, and all of the test applicants amount to about 30,000. And this comes amid increased outbreak in the metropolitan area, and I am very aware of the public's concern. We are cooperating closely with the ministries like Education and Interior Ministry so that we can prioritize the importance of safety, and we have put in place intensified quarantine measures. We will limit and reduce the number of test applicants in a single room from 30 to 20, and we will enable people to have distances, and we will also enable a separate room for people with symptoms like fever. And also the test applicants need to have a sense of responsibility, and please comply with these quarantine guidelines. And next, we have the 2020 special week of holiday, which will be adjusted. The government, after the outbreak of the COVID-19, we aim to revitalize the tourism industry here in Korea, and we have been revising the idea of adjusting the special holiday week here in Korea. However, concerning the metropolitan outbreaks, we will adjust the period, and we will postpone the date for 10 days from June 20th to July 1st, and the total period will also be shortened by 10 days. And they include the closure of the casino land in Gangwon, the province Cheongsan, as well as other resorts and facilities. And we will be looking at and monitoring the situations of the outbreak and make further adjustments if necessary. I know that we are having great restrictions in the COVID-19 pandemic. However, we ask for your participation, and the government will also aim to stabilize the conditions of the outbreak so that all of the members of the public can enjoy their leisure, sports, and holidays. And next is the management for the disclosing of the whereabouts of the confirmed cases. Up until now, we have seen some of the cases where the confirmed cases whereabouts have been disclosed on the internet, including SNS platforms, and they infringe upon the privacy of individuals, and they also have inflicted secondary harm on these business establishments. Therefore, we have asked the information agency to delete such information, and they will also implement an enhanced erase of these information online. And we also ask for the media outlets to delete these information that has become outdated, and we will also revise the amendment to the act as well, and we are implementing the situation and system to protect one's privacy. Yesterday at a screening center in Incheon, 3 nurses who were working at the screening center, they fainted. They were under the hot, scorching sun, and we felt very unfortunate. As the temperature is rising, we believe that the fatigue level of the medical practitioners are also on the rise. So we are ever more much concerned. And during the summer, we aim to enhance the conditions of the working conditions in the screening clinics, especially aside from level D protective gears. We aim to provide 4 sets of protective gowns and protective equipment that are more breathable and more convenient. And we will also shorten the hours of operation, and we will also go over the issue of providing costs and support for the air conditioning at these facilities. And all of the partial return of our routine daily lives were possible thanks to the dedication and sacrifice of these medical practitioners who are fighting on the front lines. And the only way that we can pay back to their dedication is by keeping to the quarantine measures. And please, we need to remember all the thanks to these medical practitioners. Thank you very much.
다음으로 전자 출입 명부 영상을 시연하도록 하겠습니다. 저쪽에 보이는
That was a live briefing from the South Korean health authorities you just heard there from the Vice Health Minister. We just heard that there were 50 new confirmed cases of COVID-19 here in the country, bringing the accumulated total to 11,902. There were unfortunately 2 more deaths, bringing the total death toll to 276. Well, that wraps up our coverage of this morning's briefing. Thank you for staying with us, and we'll be back with our regular newscast at midday Korea time. Bye for now.